put on record at the start of this debate, I am massively pro-vaccine. I think it's the right thing to do. I think it's the right way for us to move on from this pandemic and to protect ourselves. But I also agree with what the Honourable Member said in his statement, in his opening statement, about the importance of that bodily autonomy and about education as opposed to forcing people to take it. In terms of business, I certainly don't think businesses should be forcing existing staff, and I can't imagine how they would be benefiting their own attractiveness as an employer or their viability as a business by seeking to do so. But I particularly want to focus my remarks on public services, if I can. As a county council leader, I am directly impacted by this as somebody who has to deliver social care services. And while staff made an incredible effort over Christmas to try and mitigate the massive staffing pressures that exist in that sector, and my thanks go out to all of them because it was an incredible effort to do that and to protect those services and vulnerable people as far as possible. The impact has been huge. We've already, as a county council, gone from a position where we had no waiting list for social care provision just a few months ago to now having 400 on that waiting list. It is hugely important that we are not further hit by additional staffing issues. We're having care plans handed back regularly at 4 o'clock on a Friday afternoon to my Director of Adult Social Care for the Council to pick up because care services can't deliver them over the weekend. We're managing it so far, just about, but there are further issues, including mandatory vaccination, that will continue to hit us. We've lost some staff already. We're set to lose more. Overnight, the hospitals, NHS trusts have put out some of their figures about how many staff they're set to lose. My local hospital is set to lose around 200 staff from February the 3rd, which, as my right friend from Tatton said earlier, can only be of detriment to the continuing backlogs and the continuing challenges of NHS pressures that already exist. I didn't vote for mandatory NHS vaccines. In hindsight, I wouldn't have voted for care vaccines either, but I can't go back in time, unfortunately. I think government still has time to rethink, and that is my plea to the Minister in this debate. I think the debate more widely about the importance of that bodily autonomy, our rights and freedoms, is a hugely important one, but in this particular instance, the health argument doesn't stack up either. As we move out of a pandemic, touch wood, and we move beyond the period of most intense risk, I cannot see how it can be okay for these staff to work throughout the most risky time of the pandemic when transmission was at its highest, and then as it falls away, as the risk recedes, we sack them. We know, and the evidence suggests, that Omicron is less impacted by the vaccine. We've argued, when it came to vaccine certification, which I also didn't vote for, that it's okay to have a daily test, and that mitigates the risk of not being vaccinated, but we're not making that case for NHS or care staff. I don't see how we can argue both positions at the same time. And as we've touched upon, 73,000, 80,000 staff to go across the NHS, big numbers across the care sector. That can only make it worse, where we have those backlogs and waiting lists in both sectors. I don't know how it chimes with our commitment as a government to 50,000 more nurses or doctors or whatever it was, if we're going to get rid of 80,000 staff across the NHS. It's nonsensical. And I would understand, I totally understand people's willingness or people's wish to choose a vaccinated carer over an unvaccinated carer, but truth be told, that is not the choice. It's unvaccinated carer or no carer. And if it were my elderly relative being looked after, I would certainly prefer them to have somebody rather than nobody. Listening to Radio 5 this morning, I heard a GP making the same argument about a colleague in his practice who had been there for many years, who had worked throughout the pandemic quite successfully, as far as access to GPs go, which is another debate we could talk for hours about, but has managed to work throughout the pandemic and now is faced with no longer being able to see patients over the course of the next few weeks. How is that better than having an unvaccinated GP? So there's still time for government to reconsider this. I really think we do need to delay this 3rd of February deadline, hopefully with a view to reconsidering it altogether in due course. I recognise there are probably significant legal implications to reconsidering the decision for the care sector, with people already having lost their jobs in that sector. But still, that is not a good plan, and it is not going to help us to deliver those services. So I call on government to reconsider. The evidence doesn't make a strong enough case from a health point of view to override those freedoms, to override that bodily autonomy, or to exacerbate the staffing issues that already exist. So again, I'd call on government to think through over the next week or two very hard as to whether this is something they really want to do I certainly don't think it is, Mr. Chairman.